Perfect.
Now I see me.
Yeah, I think we're all on there.
Okay. Well, it's 10 o'clock, so I'm going to call the meeting of the Regional Advisory Council to order. Welcome, everyone. Glad to see you today, either in present or at a distance. So glad you're here.
We're still Zooming.
Our first item, let's see, you have the, Jessica, you have the attendance. We have confirmed quorum, fantastic. And let's just go around the room and introduce ourselves. Obviously, I'm Bea Babbitt and I'm chair of the RAC.
I'm Marilyn Bradish, representing Colorado Springs and membership chair.
Melissa?
Melissa Martz with the Pikes Peak Area Agency on Aging.
Our guests?
Jason DeBuena, Silver Key.
Dayton Romero, Silver Key.
And Erica Carter, Silver Key.
And our guests in the audience here today?
David Biner, Next Day Access.
Just a moment, the last person, Gretchen. Okay, and our guests on Zoom, I guess I better, Carol,
Carol Parks, Teller County.
Bill,
Bill Bowles, Park County.
Eric,
Eric Bidwell, DHS here in El Paso County.
Rosemary,
Hi, Rosemary Jaramillo with the Alzheimer's Association.
Laura,
Laura Cruz, PPACG Mobility Coordinator.
Marilyn,
Hi.
okay. David,
David Biner, Next Day Access.
and Kathy.
Kathy Lowry, Teller Senior Coalition.
Okay, did I miss anyone?
Yes.
Chris?
Yeah.
Oh, we can't see you, I guess. Okay.
Yeah, I can't get my camera to work. Hi, B. This is hello, everybody. This is Chris Marie Larson with the Seniors Alliance Platte Canyon, and I am the TRS chair for the AAA RAC committee. Good to see everybody. Well, I can see y'all at least.
Well, welcome, everyone. Appreciate your attendance today and your contributions. Okay, our first item on is the approval of the agenda. Are there any changes we need to make to the agenda?
I didn't see anything.
No? All right, and then the minutes.
So Chairperson B, I do have to make an adjustment to the minutes from May, if I may.
Yes, go ahead.
So with the TRS committee, what got noted in the minutes for the meeting were the actual funding figures that were only for our providers. I did not put in the total funding amount. So the total funding amount that actually went to the PPACG board, total requests were 7,494,510. And what was approved was 5,516,965 versus 3 million. So those have to be amended. And so with those amendments, I would move that we approve the minutes from May.
Okay, I believe we need a motion from one of the RAC members.
I so motion.
The minutes
Chris?
as amended.
Chris, thank you, Chris.
I'll second Chris.
Did I hear a second from?
Carol, I'll second
Carol?
Chris. Yes.
Thank you. Okay, we have a motion to accept the agenda and to accept the minutes as amended. All in favor, say aye or raise your hand.
Aye.
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 And those opposed, nay. Hearing none, the agenda and minutes stand approved as corrected. Okay, then we're at the public comments. Did we have any public comments, Melissa? No? Okay. Then we're going to move on to our provider presentation.
Well,
So-
thank you, B, and thank you, council members, for the opportunity to present to the RAC today. Again, I'm Jason DeBueno with Silver Key, and I want to share with you that normally in the provider presentations, we talk a little bit about what the AAA has funded and what we've achieved and able to provide to the older adult community related to those funds. I wanted to suggest that we do a little bit different this time, and both B and Melissa were supportive of that, and I'll tell you why. The first thing is that you do have in your report the actual services, so consistent with all the other presentations, it talks about what we've achieved and how we have with our AAA funding and certainly other initiatives that Silver Key works to achieve as well. That said, the reason why this is a little bit different of a presentation is because there's only been 2 times in my understanding of Silver Key where our board of directors has moved forward with a decision that's pretty significant for the community and certainly significant for the organization. And so our board had unanimously, if you'll recall, at one day I had presented a very impassioned plea that we need to make sure that people who qualify for Medicaid have the full benefits of that Medicaid benefit. And our board has taken a very strong stance on that. And we've had some great action through legislative work and some other initiatives there that we'll be able to update later on in the year. But the second major vote that our board has taken on was to recognize and understand that something needs to happen related to housing options in this community. And when I say this community, we're starting first with Colorado Springs because right now Silver Key owns some land that's adjacent to our campus, which gives us an opportunity to establish an affordable housing option for seniors. So our board has unanimously decided that we will move forward with moving into establishing affordable housing that Silver Key owns, and we will be contracting the management of that. But the full range of services that we have available to seniors right now will be wrapped around this affordable housing complex. For those of you who don't know, I'm going to give you a little bit of history of the organization just briefly, that when the Silver Key organization was first established, the reason why it was established, at least from the literature I was able to find, is that many individuals with tuberculosis were moving into the community and moving into Union Printer's home. And so many of those individuals, either from the community or outside of the state, were moving in and didn't have any family connection or friends or any kind of connection for individuals, particularly because the level of concern about of the contagion, that maybe somebody would be ill by connecting with somebody with TB. So those volunteers established Silver Key first to be able to provide companionship to those folks, to be able to say people have got to have, we have a moral responsibility to make sure that when somebody is ill, they still have connection socially. Over the last year with COVID, that has been the charge that's been able to continue to have Silver Key be available across all the services that we do provide. We didn't stop services at any point in time related to COVID, because similar to what happened with what established the organization early on, is that we were going to make sure that people had access to communication with others, had access to the meals and the nutrition that they need. Food is medicine. Without food, quality food, people decay. And then access to the essential medical appointments through transportation. All of that remain core to who the organization is. But the reason why this is a different conversation, a different presentation a bit today, is because one of the things that we understand is that while we may have access to food, while we may have access to medical appointments, while we may have access to companionship and being able to address social isolation, we know without a doubt that the first level of support is to be able to make sure that people have access to housing. If you don't have access to a housing that you can afford, where you're not making a decision about paying for rent versus your medication, or making a decision about paying for rent and eating, or making a decision about paying for rent and can't afford the utilities, there's a moral responsibility that we have as a community to fix this issue. Now, the issue is much bigger than Silver Key, certainly. The issue is larger than what Colorado Springs or the county, maybe even the nation can fix. But I will tell you that sometimes I think that to be able to start something small, the ripple effect can be significant. And our board has unanimously decided that we will move forward with an affordable housing option for seniors in this community, only as a start to what is going to be able to hopefully start to address the issues. People who are in the older adult demographic should not have to struggle with a place to live that's safe, secure, because again, I think there's a little bit of a saying, we stand on the shoulders of giants. This community was established by many people that we know that have lived here for many years. And the fact that they may not have an option for housing is again, it's a challenge that we need to think about. So our organization has elected that we are moving forward, and through moving forward, what I wanted to do to present today, and our team is presenting why we're moving forward, what that looks like. And I actually have an ask of all of you. I'm not asking for money, not asking for anything else except your feedback. I would like to understand from your perspectives, does it make sense in this community for us to move forward after some compelling information is shared with you? And I would like your opinions about Silver Key moving forward with this specifically. We have some history in housing. For those of you who don't know, back in the 80s, we were the sponsoring organization for Senior Heritage, which is the business that is, I'm sorry, not the business, the nonprofit over by Patty Jewett, by the senior center out there. And with that, we have 33 affordable units that Silver Key's been the governance of that project since the 80s. Many people don't know that we have a distant cousin that's B's like, nope, I didn't know that
No.
about our portfolio. So this entry into housing is not going to be foreign to us, but what it is that it's going to be much more visible. And the only way we can move forward in a way is to be able to get the feedback through the community, from the community, and be able to make sure that we're honing our message well. And so I'm really going to lean heavily on all of you. If you have thoughts, opinions, beliefs, good, bad, right, or wrong, and whether this makes sense, I want to hear it, because we do not want to stumble in this. In fact, we want to be able to make sure that we're setting the stage for success. So with that, there's probably some questions. I'll ask maybe if you hold those, if you have questions or comments till the end, and I'm going to turn it over to Erica to present on the next slide.
Thank you, Jason. Can we go to the next slide, I guess?
And we'll keep,
Okay.
keep going. One more.
One more.
There you go.
Okay, thank you. So I'm just going to speak to some of the social determinants as I kind of introduce Dayton's part of the presentation. Many of the services that Silver Key provides already address a lot of these social determinants. So from a public health perspective, as it's kind of evolved and its perception of what health is and those social determinants, some of the things that Silver Key addresses have to do with all of these different things. So the family income, as far as the financial literacy and the senior health and wellness, the providing the meals through the home delivered meals program. We do the transportation as far as helping to provide transportation to not only to medical appointments, which is access to healthcare services, but also to employment, volunteerism, and to social aspects of that, to see families. And so then also the home delivered meals a lot of times provide that social support as well. Just sometimes the people that they see through the Meals on Wheels and the home delivered meals may be the only social contact that they have during the day for our seniors. In the Connections Cafe, we also have throughout the El Paso County, and they provide that social support within the community as well as our nutrition. So when we look at Maslow's hierarchy of needs, which I'm sure many of you are very familiar with, addressing those needs just on the base level right there is what we're targeting, so that they can move on to feeling safe and feeling a sense of belonging. And so one of those components that seems to be overwhelmingly discussed and come to our attention is the housing. And so that they can feel that stability in housing, along with the food and the community. And so affordable housing seems to continue to be the focus, and focusing on the whole individual and their health.
for our seniors. So Silver Key is working toward that. Can you go to the next slide for me? Thank you. So stable housing is associated with better health. And as we have on here, Coloradans lacking the stable housing are more likely to report the poor physical, mental, and oral health. Creating affordable and accessible solutions is critical. We see this need throughout the community, but it's very apparent in the senior arena, especially with the senior population growing, excuse me, so immensely, and will continue to grow in the next few years. So that'll be
Erica, this is Laura. I hate to interrupt you real quick, but the slides are not progressing on the screen.
Oh,
In the Zoom world. So I just
Okay.
wanted to let you guys know.
did you see the previous slide that had the social determinants on it? No. Oh,
No.
That one works. Stable housing is showing now on the Zoom screen.
Okay.
There it goes. Now it's working.
Okay. So you might want to
Awesome.
go
Thanks,
backwards a couple. Yeah. Uh, we were to the
You're doing great, Erica. You're doing great.
Thanks. Hopefully I gave a
Slide
pretty good
6, right?
description of the previous slide. Yes, now it's working. Yep, and forward one more. How is it, Laura? Yes.
We are at stable housing and
Great.
equals health.
Okay.
All right,
Thank
all
you.
right.
Now we're at summary origins. So
Dayton.
Laura, thank you so much for raising the flag. We ourselves are trying to navigate this this new world, this hybrid model, right? It's a double-edged sword and the convenience in it, but also just the value in being here in person with everyone. So thank you for accommodating this. And I like to just kind of kick off by thanking you all for what you do here. What I'm going to try to illustrate here is the impact that you all have, as well as some of our current focal areas related to housing and how Silver Key is currently fitting into the community. And I thought a good place to start. So for those who don't know me here, and I see a lot of familiar faces, I started at Silver Key about 6 years ago as a case manager. Now my role is director of health and wellness. And so I get to work alongside the providers who see the situations that our seniors are experiencing on a daily basis, having to navigate those circumstances that Jason was talking about, of having to make decisions that morally we shouldn't be in, food versus the roof over your head. So with that said, kind of starting from the beginning, our group, our case managers were looked to by thought leaders, and there's some there mentioned on the slide, but our case management group was looked to be asked in a focus group of, what are you seeing in the community? What are our seniors seeing? And what is one of the most prevalent needs? And housing immediately surfaced. It was navigating a competitive housing market with a fixed income. And many other barriers just started surfacing, from transportation to technical savviness to being able to just put down a deposit. These are things that we're seeing on a daily basis, and more now than ever. And so what did we do about that? We probed a little bit more into the community. There's Community Health Partners is a wonderful organization in our community who does a survey called A Point in Time. It's called the PIT survey, where they go out into the community and get a hard count of how many homeless individuals are living here. in their community presentation, we saw that the senior group was underrepresented. So I'd ask, where are the seniors in this presentation? And what we found really quickly is that the senior demographic was experiencing the biggest uptick in percentage in experiencing homelessness. And so we said, what can Silver Key do in this regard? And that is what kind of led us to these three things that you see here that we'll be talking about, which is housing navigation, affordable housing, and the Behavioral Health Collaborative. Next, please, Jessica. Thank you. So like I said, being a strong, outspoken leader in the aging space, we felt was our responsibility to get this awareness, get this piece in front of people, and kind of probe around to see the awareness piece of what seniors are experiencing in our community. That started with community health partners, but I think what propelled it further, and some of you maybe have been familiar with these events in our community, which were the Taylor Apartments, Emerald, and Regency. These three events resulted in displaced seniors as a result of a fire at one, and two, again, our competitive housing market, outside buyers coming in, buying the apartment place, and rents raising. And so our seniors, so many times their leases are done 1 year and it goes month to month, and it's done over a handshake from there. So equipping them and educating, giving them the tools in our housing navigation has been a focal point. So on one side of the house, it was very tough in helping these clients, get that sense of stability back. But Silver Key was looked to step up and be that leader to intervene and support those individuals who were experiencing this in all three instances. We were very privileged and honored to serve those people and also work alongside city council members and others who were trying to bring awareness of these events. And so we were proud to say, and with your support, we were able to intervene and prevent from any of those individuals from being homeless. So the challenge in finding those clients housing was challenging, but we were successful. The flip side of that is that, again, it got it on the radar. There were newspapers articles on it, and this increased awareness in our community. Thanks. Thank you, Jessica. So I thought we'd start with the idea of results and impact and kind of the evolution of our housing navigation program. So we'd received a 2-year grant that launched our housing navigation program. And with that, our approach was to really gain insight from the other housing navigation models in our community and what were their successes, what were their challenges, and we wanted to kind of take each of those nuggets and formulate our own housing navigation program so that we could help those seniors who were experiencing those barriers whenever it came to transportation, technology, and other barriers that they see, fixed income being one of the most prominent. With that really had a ripple effect, again, with our partnership with the city, and they have some dedicated funding toward housing initiatives. They have one called the Emergency Solutions Grant. And so this got us on the radar of the city as an advocate in the housing realm for seniors and how we could plug in supports for them financially and also, physically, sitting across the desk from them and helping them identify and find a place. Additionally, we'd received some grant funding that had geared toward a housing feasibility study and an application. Silver Key long ago, and Jason had mentioned the Senior Heritage Plaza, which Silver Key has been involved with since the 80s. Silver Key used to be on Bott Avenue on the west side of town, and it was a big move for us coming to the east side of town where we did. But the leaders of Silver Key had a vision for that lot that is adjacent to our campus. They had that foresight in that, is housing going to be a challenge considering the demographic growth that we're seeing, not only in our community, but nationwide. So they had that foresight to see what can we do with that land? So all the way from years ago in that regard, we were able to really gain an insight on what that process looks like. What does submitting a low-income housing tax credit application look like? What does getting into the affordable housing world look like? And so we were on the road to a big learning experience, both through the application process and also understanding the level of support that we would have in getting this application out and it being successful. So we had another senior housing navigation fund, and navigation tends to be a buzz term right now in terms of, you know, who is really sitting across the table from these individuals, listening to them, understanding their barriers and their preferences, and what will ultimately improve their quality of life whenever it comes to housing. And we found that, one, it's a lot of work. It is a lot of work. And with our initial try, it was one person who we were putting some gravity on of, can you help us implement this? And what we realized really quickly is that we need to build our bench strength in hiring more navigators to allow our seniors in our community feel heard in what they're experiencing in this housing market. And also, how do we understand those other funding opportunities, you know, with our city, so that, again, we could increase our capacity to serve those individuals. Navigation, in some senses, are taking a phone call and giving another phone number. That's not what we're doing. We're sitting across the desk from these individuals and not looking at housing as in a vacuum and as a sole purpose. Yes, it's the imminent, but we want to address the whole person. We want to understand their needs and draw those goals out. And so we do that by providing behavioral health services, counseling services. We saw that come up and kind of be a dual effort in those occurrences that I'd mentioned with Taylor and Regency and Emerald, where we were providing not only let's help you find a place or get you connected with family out of state, but we were also providing counseling to help them through that trauma. So with that, you know, through the second round, we were assisting with 370 housing clients. And today, you know, our silver line, which is our single entry point, it's where the community, the clients, everyone calls to get connected to any one of our services. We're receiving about 5,000 phone calls a month. And of that, a big percentage, the prevalence among those who are asking for housing needs is just overwhelming. And so we're trying to become creative on how do we help these individuals with these very complex issues. So with that, you know, we're continuing to be creative and figure how we could best support these individuals. And with that, you know, we'd gotten a vehicle so we could actually take clients out and look at these places. So again, bench strength, educational tools, and we are continuing to evaluate on how we could best support our clients whenever it comes to threading the needle. I'd mentioned that to B earlier, threading the needle and finding those places that they could call home and settle. So how do these two things connect? Like I'd said, those who are in a situation where they're making those tough decisions, where where hope is really at a loss. I'd seen a client, we're working with a client now who her roommate just passed, and her roommate owned the place they'd happened to be in. And so she had to be out. She has a cat and a dog, and on a fixed income, mobile, uses 2 quad canes. And we'd asked her, what's the plan for the weekend? It's, well, I guess I sleep in my car or I go to the shelter. And we're talking about some of the most vulnerable individuals having to say, I'm going to sleep in my car or the shelter. That is just so wrong, one, to me, but it gives me chills to say, okay, this person, how do we help you and bridge that gap to, one, is it a care facility? Is it a home? And how do we help you gain that sense of stability and hope back? And so with this collaborative that we've launched, which is inclusive of some key collaborators in town with NAMI, Innovations in Aging, and the fire department's CARES team, who is very familiar with those who are the most acute And in terms of severity, most acute in our town, frequent 911 dialers, we've partnered to create this seamless care model where clients, we're trying to prevent them from going down this continuum of having to make those 911 calls or visit the ED frequently. Alongside that is us shedding light on the lack of coverage in insurance, medical insurance. Access continues to be a barrier for so many in our community. And exclusive to seniors, we see those who are dually eligible, is what they're called, right? Those with Medicare and Medicaid. And I know AAA with their SHIP counselors probably know this like the back of their hand. But in that, what we found was a big gap in coverage in terms of critical supports, case management, therapy by a licensed an LPC. So these are what SilverKey offers, but this is not covered by insurance. So they run into some barriers there in terms of lack of access of supports because of what medical insurance covers, as well as a more narrow provider network because of what they have for insurance. And Jason, if you have anything to add on the insurance coverage piece, or okay. So we are really looking forward to develop a program out of this initiative that is replicable, scalable, and makes a big splash in the policymakers' eyes, and that we're going to be able to demonstrate those who are falling through the cracks. That's where innovations comes in, where they're going to be writing a white paper based off of the data that we're intentionally collecting in this initiative. And so again, with those who are so hopeless with the housing piece and others who are coming in right now, utilities is another big need amongst our seniors. We are intentionally learning from this to see how we could really beef up that infrastructure in terms of support for our clients. So I thought this was a powerful slide, and I mentioned some seed funding earlier, and we have an amazing local foundation and who supports us significantly. But other than the dollars that you see in front of you and the 420% additional funding that we're able to leverage here with other stakeholders, I think the big piece here is to show the investment of multiple stakeholders in our community in this cause. Jason was saying, we'll lean on you to say, does this make sense? And I think, given this diversity of people, funders, and investors in this initiative to help us help others, I think is really telling in both on recognized need in our community and what we're willing to kind of put forth in order to support these individuals. So where are we today? I will leave it to Jason if you want to kick it off.
Sure. Let me just share with you where we're at today. And I know we're running out of time in this presentation. A few things that I want to share with you first. Our first intention is to connect with the HUD, Housing and Urban Development. And the reason why is because what we're going to do is recast the name of Senior Heritage to really reflect our history of SilverKey being involved. So we've asked HUD for approval to rebrand it, SilverKey Apartments, managed by the Colorado Springs Housing Authority. Now I've sent letters, I've called, I've certified letters, and now I'm sending smoke signals to HUD. Somebody answer. The good news is that regardless of whether we get that approval anytime soon or not, we do want to recognize that Senior Heritage has been very much part of SilverKey and part of our application moving forward with the funding that Dayton so well expressed. A couple questions that have come forward in other presentations that we've done. The first question is, well, how many units are you talking about? We know the Villas has 100. We know that, the 33 at formerly known as Senior Heritage. We know that those are the ranges. Just to let you know, 2 years ago, we were starting a pro forma to be able to figure out how many actually could we do with the type of funding that's available. At that time, the pro forma looked like we would be able to bring 70 units. In 2 years' time, with the cost of supplies, with the cost of all the materials, we lost the opportunity for 20 units. So we're right at about 50 to 60 units right now. And so we can no longer wait. If we're going to continue to lose that amount of opportunity just by the nature of how much it costs to build, we have to move now. And so I will let you know that we don't have the final words yet, but we're looking at between 50 to 60 units, depending on what we can afford through what we're able to arrange in financing from the state, the local community, and then also some of our other connections that we have kind of nationally. So at this point, the general number is about $12 million to be able to move this forward. So it's not a small amount of money, but as Dayton had articulated, we already have some commitments across the board at about $1 million in different ways to be able to get there. And we think that that's just the start, because the main part of our funding would be from what was called the Low Income Housing Tax Credit, LIHTC. And through this, that's a 9% tax credit initiative that brings dollars into the community to establish this. I'm a native to Colorado Springs, so it's kind of disheartening for me to share this with you, but it's also something that just to be, I think, real. Colorado Springs has just experienced such monumental growth, and the area that has probably not have seen that level of support is in multifamily housing. Multifamily housing, unfortunately, has a stigma attached with it. And for those, it's not a shocker to anybody, so hold on to your seats if this is, but the not in my backyard is a very real concept that affects communities with stigma in establishing multifamily units in a community. That said, for whatever reasons, based on our history in the community, as Erica and Dayton talked about, and then also what our future is as a Silver Key system and the population we serve, we actually have a way to be able to have that message be a little bit different than the traditional multifamily issues. Puppies, children, and seniors, for some reason, have a pass a bit in a community about, yes, we should. And so we're taking advantage of that. Sorry for the multi-unit family or multifamily units, but that's the path that we're taking. We want to be able to demonstrate the need. We want to articulate the stories that are very real, as Dayton just shared about the woman who is going to be in the shelter if we did not intervene. That's not a single story, that's representative of a population. And so for that reason, that multifamily stigma, we think that we've got a bit of a pass in that, at least for now, so that we will be able to demonstrate that we have the capacity, we have the right demographic, and we have the competence to be able to move forward. The last thing I'll share with you is that we will be establishing a website page, or a page on our website, that will be able to continue to bring you up to speed on the status of what we're moving forward with. The reason we haven't published that just yet is because we've got a few things that we're working on with some of our media. What I would ask and beg and plead, I just earlier said I'm not going to ask anything of you than your opinion. Now I'm changing that after this presentation. Please, please, please like, share, and be engaged in our social media, because good, bad, right, or wrong, the world has changed and people are gaining a lot of attention through social media about these kind of efforts. So wherever you see that Silver Key has posted information and knowledge about what we're doing, please like that. And if for some reason you're like, I don't like that, please call me, because I really want to understand what are we missing along that path. Again, I just want to thank you and the council members for the opportunity to present and the public to hear us out on this particular issue. The last thing I will share with you is just the time frame. We are moving forward with our application. We're securing a developer by September. We'll be moving our application forward, our letter of intent, to CHAFA, the Colorado Housing Financing Authority, in December. We'll be submitting our application this February, and we're hopeful that we get word by next March. That said, if for some reason we are not selected, but through your liking, sharing, and posting of how much you agree with this, I think we got a good shot. But if we're not, Silver Key is in this to win it. And if not this year, we will figure out through the year how to make this happen. I'll pause right there, B, and answer any questions or any concerns that people may have.
Great. Thank you so much for the presentation. Do members have some questions?
I have a question. This is Chris Marie Larson from Park County. Generally, as far as did you arrange for or interview developers before you made this move in your planning ideals? Because it's something we may be very interested in. So I'm curious, was that an active process before you started assimilating funding?
So great question. So just so you know, the way that it worked is that we had in the past some developers who were supporting us, And the problem was, is it was a little bit of tail wagging the dog. The developers are very astute at being able to move an initiative forward, but nonprofit world and the level of connection with LIHTC, the low income housing tax credit, is a different animal. So what we had to do is put a pause on that, and we actually reset. We are now driving a request for proposals. So we have 7 different developers that have responded. And so my suggestion to you is that if you're going to move forward with this, I would recommend that you do this as an RFP process, and that you you define first your mission as an organization, your intention and what you're trying to accomplish, and that you are the dog that's wagging the tail and not the other way around. Because I think what you'll see is that with some of the examples of the affordable housing projects, those projects have been here in this community for 30 years. And the moment they were available to convert, the owners converted. And then those seniors were displaced. So you've got to be able to establish, if you're moving this forward as a mission-driven entity, that the developers understand that you're in it for a long haul. So that would be the recommendation. And we are in the process of selecting one of our 7, and we're outlining what those steps will be in their work with us. Does that help?
Absolutely. Thank you.
Yes.
Other questions? Rosemary?
Hi, thank you for this presentation. I'm jumping out of my seat. in excitement.
So am I. I can't contain it,
I'm
Rosemary. I'm like,
so
oh my gosh,
excited.
Jason, be careful, be kind.
Yes, it's great. I don't know if you've connected with Pastor Ben from the Community Development Corporation. They're working on some low income housing over in the 80910 zip code. That'll be a great connection for you. But just to let everybody know, so there's a lot of stuff happening in the Southeast. We're really excited. I think one of the reasons that we look at when we hear people are building a new community is that connection and that relationship. So I think there's a lot of trust with Silver Key. I think people know your organization, and I think they're going to embrace it 100%. I think we're so excited. And so just to let everybody know on the call too, and this is important, in the Southeast where you're talking, the life expectancy is 16 years shorter than in other areas in Colorado Springs. We do not have, the closest emergency room is 15 minutes away. So we don't really have access to that. So hopefully this can help bring in some other resources for this area. That's my hope, because when people see things moving, they go, oh, this might be a good place for us to be. We're working on a $6 million park. Silver Key was helpful in that, in working with that. And so really that relationship building and that name brand is so very important. And so I'm so excited that you all have taken this on. Thank you, and blessings.
If I may, Rosemary, I so appreciate your comments, and I couldn't agree more with you. I could say, because with Silver Key, I was there on Bot, which at the building that had a lot of character. Again, that vision of those leaders then to move over to an area where there is lack of access is so important. And I'm with you on zip codes. It's so interesting the how zip codes tie with life expectancy. But to what you're talking to in that connection and that access, Silver Key, even with other up and coming affordable housing projects in town, have looked to integrate Silver Key's services from our congregate meal sites and our transportation into their actual plans to make their applications more attractive to CHFA. So Silver Key, having something on campus not only increases that accessibility, but we're really kind of we're being a pioneer of a model. And whenever it comes to permanent supportive housing, there's these delineations of attainable, affordable, et cetera, but permanent supportive housing has evidence-based practices behind it and is proven to work in communities who are struggling with housing. So thank you,
Yes.
Rosemary.
And I think that's important too, because the trust and the relationship is there. Because we've seen throughout the city where affordable housing has gone up, and I don't know who could afford it. Or it's built under the premise that this is affordable housing, and it really isn't. So I think that relationship and that trust, and the fact that we know when you say that that's what it's going to be. So thank you.
Chris, this is Marilyn Massey. I have a question.
Go ahead,
you're-
Marilyn.
Years ago, I lived in Alexandria, Virginia, and in every complex that was built, didn't matter how elaborate it was or how low income, all developers building new housing had to set aside a certain number of units for low income. Does that relate in this community at all? I've never heard of that in Colorado Springs.
Marilyn, just so you know, this is Jason, if I may, just to let you know that the regulations around accessibility and affordable housing have not necessarily emerged here in this community. And the other thing that's a bit of a challenge is that some of the developers that you have throughout Colorado Springs, actually throughout El Paso County, and I don't know if this is the case in Park and Teller, but I will let you know that there is a federal requirement that some accessible housing is part of the overall plan. And what happened with this particular example is that one of the developers here in town had a commitment that they would have 2 units out of 100, I think 30 units that they had available that would be accessible. My wife has developed a very challenging bone and joint disorder, and she needed an accessible house. At the time, which was 5 years ago, the stock that was available for an affordable, not for an affordable, but for even a housing project at all that would be able to have an option for somebody with a disability who needed accessibility, there were 2 homes at that time. And somehow through blessings, as Rosemary has said, we were able to purchase the one, but we had a little bit of resource that others probably would not. We sold a shack in California for an obscene amount of money. And here we were able to buy something. But for those individuals that may not have been in the same position that we had, there absolutely is not enough, not only affordable, but houses and housing that is modified to be able to support an aging community. And so, Marilyn, I will let you know that while this initiative is part of bringing units to this, the influence about what it takes for a community to be responsive, to be the healthiest place to age, I think is part of the game. And I know that the villas at Southgate being represented here, that's one of the pieces that's been core to the villa's work for years and years and years, is to make sure that the accessibility is available. So I commit to you that this is what our path is as well. And thank you for the comment.
Well, there was a lot more than 2 per 100. It was like 10% of all apartments that were built had to be available through a subsidy. And the city of Alexandria did the subsidy. But anyway, thank you very much. I appreciate your explaining.
Other questions? You have a question?
Hi, this is Dave Summers with Invita. I think Invita is really pleased to support and recognize Silver Key's work on this. We have partnered in a number of efforts, and I think this is another one where I actually see an opportunity. When you have folks on Medicaid moving into these units, some of them are going to need some long-term support services under Medicaid, and you've got a partner here who can provide that help. So I hope we can partner with you again. I just had a wonderful conversation last night with Chloe Lamprey at El Paso County about the shortage of accessible, affordable housing for seniors, particularly out in the rural areas of Eastern El Paso County. We've got folks who want to stay where they've lived for decades and there's nothing there. Where you're planning to build your unit, thankfully, is on kind of the edge of town. So people wouldn't have to move quite all the way into town. But boy, if you wanted to do a second unit out east, there's opportunities here. I think this meets an unspoken need in the community for what's needed for our seniors. Thank you.
Just real quick, thank you, Dave, for that. And of course, we will partner with the Invita organization, Fountain Valley. We've had some great collaboration along the way. Just to let you know that for the second unit and the third unit, our facilities that we are talking about. This is just the start of what I think will be a significant opportunity for the communities overall. And the reason I share that is because what happened is that many of the people that are moving out of Colorado Springs are moving into the rural areas because it's a little bit more affordable. The problem is you don't have access. You know, we talk about the desert that Rosemary was saying in East Colorado Springs. It gets a little bit challenged on healthcare desert when you go even further than that. So we anticipate that with the funding that we have with the Pikes Peak Real Estate Foundation and Fund, that they've supported this. What we're doing is we're collaborating with them to put the playbook together so that we will be able to say, once we get this first one done, that we will have a playbook to scale to other communities, and the other rural areas is potentially one of those supports.
That's awesome, because the Silvercrest Villas in Calhan have a 2-year waiting list for seniors.
And if I may, Babe, just really quickly, we'd provided this 1-page brief to kind of speak to those inventory pieces. We got that data as up to date as possible, but kind of putting those real key sort of those key indicators of where our community is at whenever it comes to cost burden associated with the lack of inventory, our housing stock, and also a little bit of information on the history of LIHTC in our community as well. So I'd encourage you to look at that too.
Thank you, Melissa.
Come to fruition for a while and bringing forward a new vision for us. So thank you. I also wanted to just remind folks just sort of kind of round.
Melissa, we can't hear you.
Can you hear me now? No? Okay. Guessing you can hear me now on the Zoom. Great. So again, just wanting to thank Silver Key for all the hard work over these years and bringing this to fruition right now immediately. And just to kind of round out the housing picture, I think some people know, but not everyone. The VOA ran a nursing home facility, Laurel Manor, and it closed shortly, just not too long ago, which was a real loss to our community. And they are also applying to build a affordable housing senior home right where Laurel Manor was. So they're looking to tear down the existing building that's there and build affordable housing units as well. So the shortage that is felt so acutely, we will continue to feel for many years to come, but there are some really great resources on the horizon, and there are people who are listening and trying to make a difference. And so thanks you guys, really good timing, and look forward to seeing these come forward.
Well, thank you for your presentation. I know this is, I keep telling you about my, I volunteer every week and answer phones, and I tell you, this is the heartbreaker. The ones where the seniors call, they say they're going to be out of their apartment and they intend to sleep in their car, and I tell you, it's a heartbreaker to listen to these stories, and so happy that you are working on providing a solution. Really appreciate that. In any way we can help support your work, we would be glad to do so.
Thank you, Bea. And just so you know, Andy Gunning has committed that Pikes Peak Area Council on Government would write a letter of support towards our application as well. So just so you know that.
Wonderful, wonderful. Well, thank you so much. Really appreciate your presentation. We're going to move on then. Marilyn, Membership Committee, do you have a report?
Hi, everyone. I think just some basic information regarding membership to start, that we presently have 14 members on our RAC membership, representing Colorado Springs, Teller County, Park County, the Community Health Alliance, and Alzheimer's Association, and commissioner appointed positions, and are always, seeking others to come forth with membership. Coming up, there are 3 of us that terms will expire on the 31st with the possibility of renewal for another 3 years. The terms are 3 years, and at that point, decide whether you want to extend for another 3 years, which 3 of us may. Bill?
One moment, Jessica, I can't see Marilyn on the screen.
Oh.
Oh, sorry.
Oh, yeah. So I
Thank
guess you've all heard me, you just haven't seen me, which
Right.
is okay. So anyway, as I was saying, there are 3 of us that may renew. Bill, Marilyn, and Elaine may renew. So be thinking about that for, coming up in December, what your decisions will be to move forward with that. We appreciate you. We want that to happen, and we are always seeking membership, especially now in our efforts to collaborate with our underrepresented populations, seeking representation for them. And another meeting has taken place with Cynthia Aki and others regarding our communities of color and efforts towards gaining information and or giving information to these people. We have been present at some events, the last of which was Juneteenth this last weekend. And there were some of us that represented the Area Agency on Aging. We brought yellow books, and it's in and out of the rain those 2 days. They had a good turnout. It's a big park, and it's hard to tell, who was where, but we had a lot of hits, a lot of people that provide care for their senior family members, and even a couple of people that kind of hinted at maybe wanting to be part of membership on that. So I think with these efforts moving forward to just be part of the community where these groups are, there's events coming up as well that, we will definitely be, seeking membership to maybe come and help with. There's Older Americans Month events. There's a Pride event at the end of July, El Paso County Fair Senior Day, things coming up that, people will be at, and that we could spread the word with yellow books and conversation with people to help bring them in to represent their communities and needs, to let them know that AAA provides services for them and what are their needs. Melissa shared with me a little piece of information that if we ever get together again, I will give to you as you are out and about meeting with seniors. And it's just, we need your input and leadership, and our leadership councils that support the best practices in Colorado Springs, which are the regional advisory committee to the AAA, seeking membership, of course, to represent people of color, Pikes Peak Commission on Aging, and of course the Pikes Peak PPACG. Just information about the whole general entity, and those of us under the auspices of these that are there to present information to people in our community, and seek their presence with our committee. So we will continue to work on these things too, and I'll continue to email to membership as events become available or possible here that help in manning booths or yellow books or etc.
Okay, thank you so much. I'm going to deliver Jody's report today. He's at another meeting, and so let me give you an update. First of all, the state fiscal year 21-22 funding option letter has been received from the state. So efforts continue by staff and providers to wrap up the process of contract execution for services for the coming state fiscal year. So all our providers are probably well aware of that situation. The state funding, state fiscal year 21-22 funding recommendations from the TRS. And thank you to everybody who worked on that committee. They were unanimously approved by PPACG Board of Directors. And so thank you again for everyone who reviewed all those proposals and forwarded your recommendations. Additional funds, we always like to hear this. Additional funds are expected in the coming months as part of COVID-19 emergency and stimulus funding measures. At this time, these fund amounts and timelines for usage are unknown. So we don't know how much money is coming and we don't know the timeline for applying for it. In addition, President Biden's proposed federal budget shows funding increases in nearly all areas of aging services under the Older Americans Act. So that's good news for all the providers and obviously for our seniors. Thank you to the RAC and coalition members who are participating in community events to raise awareness and create relationships to further increase the diversity of these committees. As mentioned, for example, our participation in the June 19th and so forth. And we have some members and staff who received recognition at the Senior Resource Council. Those included Kent Matthews, who was a staff member and was nominated, Phyllis Huggins, former RAC member, who was nominated, and Silver Key, who was nominated. All of them nominated in separate categories for the Joe Henjum Accolade Award, and Phyllis won for exceptional volunteer. So we're very happy for Phyllis and extend our congratulations. Okay, and so those are the items that Jody wanted to bring to our attention. I just wanted to, as part of my report, just add, we had a wonderful time up in Park County at the Senior Coalition Picnic at Lake George. It was a wonderful event. I want to congratulate all those who organized that event. We had a great time meeting the seniors up in Park County and winning prizes and eating good food. And I think a lot of great things are going to come out of some of the events that Park County is organizing. Okay, are there any action items? I don't think so, no. Okay, then I will ask our members, are there any discussion items, any issues you want to bring to the attention of the rec?
This is Chris from Park County again, Park County Senior Alliance. Quick statement. We were fortunate to get a last minute team from AmeriCorp NCCP to volunteer and come up here. We spent really a lot of work trying to arrange housing and food and transportation and tools. And at the last minute, they got called off to Louisiana floods. So we wanted to let everybody know that there is always hope and they're promised to come back. And it's an exciting move that we're getting some federal recognition into Park County.
Wonderful, Chris. Are there other comments by members?
That's Bill Bowles.
Yes, Bill?
The Park County Senior Coalition is having another party on the 21st of July at the fluorescent fossil beds. So details aren't done yet, but we're working on them.
Sounded great. There was such a great list of possible events. I was wondering which one they would choose. So you're going to the fossil beds. That's great. Other members? Hearing none, I guess we'll move on to our other calendar of events. Our next meeting will be July 22nd. Once again, it'll be a hybrid meeting, so you can come in person. I love being in person. But I understand that it's oftentimes more convenient to be on Zoom. So either way, we're glad we can get together. And once again, Melissa is asking you if you want to attend in person, to let her know. Our RAC Executive Committee meeting is always the first Tuesdays at 10 a.m. via Zoom. Any other events people want to share, want to tell us about?
August 7th, Silver Key has their 50th gala at the Boot Barn, and you certainly can learn more about that at our website.
Thank you. Other events? Melissa, do we have something coming up? No, not right this minute. Okay. Anyone else? Well, thank you once again for attending our meeting. Thank you to our guests and all the members who are here. We appreciate the work that everyone does, and we hope you'll join us as events come up. And I just want to say thank you, and we'll see you next month. Thank you so much. The meeting is adjourned.